I'm a cognitive behavior therapist, and what that means is I don't necessarily think it's what happens to us. I think it's what we think about and what we decide and the meaning we choose to get out of events and situations or thoughts that can lead us to feeling good or feeling terrible or numb or whatever. So, success in recovery, success in goal uh, accomplishment begins in the mind, therefore. Clear thinking, goal oriented, hopeful, uh, in my estimation, positive. Positive in the sense of not always just feeling good thoughts, but positive in the sense of uh, reaching upwards and looking towards ways of being better. Thoughts in that direction are created, can be nurtured by a process called thought restructuring or thought reframing. Basically, reframing a thought is like removing it from one picture frame. If I'm seeing a thing from a certain angle or with a certain perspective, from a certain perspective, if I put it on a different frame, it might look different. So you can do that. It's using words energetically to shift what you're thinking or feeling, and therefore what you end up doing. Hmm? Thoughts trigger emotions, emotions trigger behaviors, and those behaviors again trigger more thoughts and emotions. So, one place to start is your thought patterns. Now, CBT, which is the acronym for Cognitive Behavior Therapy, and therapists believe that there are many cognitive mistakes, like there are groups of cognitive mistakes or mental mistakes we make. Here are some examples. One is overgeneralizing, and I want you, as I discuss this, to see if you're guilty of any of these. Overgeneralizing is just drawing general and sweeping conclusions without all the facts or with limited evidence. Another one is personalizing or blaming. You're quick to decide that everything is your fault or to blame other people before necessarily having all of the information. Another issue is maximizing, or more like magnifying, making things bigger, or minimizing, making them less than. You blow your failures up out of proportion, but you discount where you're doing well. What does that result in? Hey, I never do anything right, I can never do anything correctly, so you feel bad. Similarly, discounting the positives. You downplay the good things you do, right? Somehow the things you do aren't as good as what other people do. See how that helps to make you feel not so good inside of your body? Another one is catastrophizing, where, hey, you focus on the very worst possible aspects of a situation, disregarding the other pieces. Yeah? So, hey, I know I got the job, so to speak, but I guess it's a small company, they're not all that good, you know. Stop. Practice some gratitude and appreciate what you have. Should statements. Things should be a certain way. Well, why should it? Who made that rule? You know. Check yourself and debate the thought. Do you have evidence for that it should be this way? If you don't, let it go. Another one is jumping to conclusions, again with limited information. You assume and you form conclusions without evidence. And finally, here's another one. It's called all or nothing thinking. All or nothing thinking is inflexible uh, ways of thinking where you think things are either good or bad, black or white, right or wrong, one way or the other, and there's hardly any room for negotiations or any room for middle ground. Life is really not so cut and dried. Very few things are, but for the most part, it's not. So you want to practice being a little bit more flexible in the way you're looking at life and in the way that you're looking at situations. So, as I've discussed these, I want you to consider where you might be falling short and where you might need to practice getting evidence before you make serious decisions with potentially long-term consequences based on incomplete information without enough evidence to back up your thoughts. Just because you think a thing isn't true. Just because you feel something doesn't mean it's really true or that it's based on fact. So, move towards a position where you're always assessing your thoughts and your feelings for evidence to back it up. And if you do your review and you find there's no evidence, let it go. Acknowledge that this is what you're feeling, but practice letting it pass in a mindful way. Peace. I hope you continue to practice how to think better so you can feel better and you can do better.